If you've not heard of us, SMP stands for Senior Medicare Patrol. And come this June, we will be 25 years in Hawaii. We are also in 53 other places, including our 50 states of our nation, the US territories of Guam, Puerto Rico, and the US Virgin Islands. Today, we're going to talk about something very personal and yet very universal, and that's your money. Ultimately, we'd like you to walk away from this presentation thinking about what all this savings and 401 and portfolio and assets all mean for us. It means for us to have a comfortable life, a relatively good quality of life. And if we're fortunate enough to have saved more or wisely, we may be able to extend that resource to our children and our grandchildren and their children. So this is really about our legacy, our last name, our maiden name, our parents, our ancestors, really about our name. And so today we're going to focus on your legacy by telling you how we can support it through SMP Hawaii. Our work is all about protecting kupuna, their ohana members, and their caregivers. In short, what SMP Hawaii does is we prevent, detect, and report healthcare scams through these types of educational presentations at health fairs now that we're able to open up the community and be in person, as well as one-on-one counseling on the phone that is personable, personal, confidential, and free. One of our 6 topics in the community that we have been sharing throughout the COVID period of 2+ years and then some is Medicare, your health plan, and COVID-19 scams. We are federally funded by the U.S. Administration for Community Living, or ACL for short. They package 5-year grants for us, and since 1997, we have been awarded this and administered or managed by the Hawaii Department of Health, Executive Office on Aging. So if you've heard of DOH, right, because of COVID and all of the healthcare systems are connected to, of course, our state government, one of the big offices here is called EOA. It's actually a small team, but Executive Office on Aging is charged with everything to do with aging services and supports and the aged. And as we wake up every morning, we know we're getting a little older. And so at some point, we're all going to be headed towards Medicare, if not Medicaid or both, and having to focus on our healthcare issues, if not now. Today, I'd like to introduce Jaswanda-san, who will be my co-partner. She has been with all of our programs in our section. So our section is called Advocacy, Outreach, and Education. So we are all preventative through education, which is powerful. And she will help us in this presentation on COVID scams as they relate to Medicare. She's been involved with the long-term care abundance program, as well as Hawaii SHIP, State Health Insurance Assistance Program. You've probably seen SHIP's commercial here with coaches Dave Shoji, Vince Gu, and veteran broadcaster Jim Leahy. I have been with EOA since December of 2019, and prior to that, another place in the Hawaii Department of Health with the Developmental Disabilities program, as well as those with intellectual disabilities. So we bring to you some experience in healthcare, and most of all, our love for our community. So let's begin, and please feel free to think about these comments that we're making, these remarks and resources, and know that Debbie has the PDF and the portable document file and the PowerPoint presentation, so she can share this with you. We're not sure if you know this already, but every year Medicare loses over $70 billion. And that's a modest figure because it's really hard to put a yardstick to what's lost. It's hard to measure because we can only look at what's been reported as loss. All right. So $70 billion pretty much every year. We mentioned that we are in 54 places, including Hawaii, District of Columbia and the states, and those US territories we mentioned. So one most important thing that we want to let you know is without our volunteers, we would not have SMP chapters. We would not have these, what they call projects or programs. So this is volunteer-led and volunteer-inspired. And by the way, if you listen to this presentation in another organization, through another organization, it's going to be a little tailored to that mission or that shared value of organization, because every group is somewhat different. So you're not going to hear the same content each time, which makes our presentations pretty unique. It's not a cookie cutter. Let's look at what our mission is about. Our mission is, if we take the bottom and go up, our mission is that through these educational activities we're doing today, counseling as well as exhibits at health fairs, we are trying very hard to PDR with you, or to helping you prevent, detect, and report these healthcare scams, these errors, sometimes intentional, sometimes unintentional. We're going to dissect what is fraud and abuse here. Fraud is basically criminal intent driven by wanting to do wrong and knowing it is a crime, versus abuse, which could be just once in a while, or it could be a few times, but there was no intent to con artist you or dupe you and make you lose your money. It was just a episodic, I didn't know, I won't do that again incident. So fraud, errors, and abuse have different definitions, although we'll find out that fraud and abuse kind of overlap sometimes. Why are we doing all this? It's because we want to empower you. We want to give you this knowledge. And if you practice diligence every day, you will feel more in control. You'll move from the passenger seat to the driver's seat. And our volunteers are probably the most empowered because they're doing this every day by way of counseling, presentations like jazz, exhibiting like we did at St. Francis Medical Center recently on a Saturday, talking to people at the bank, at Foodland, at Times, at shopping malls. So what is fraud as they relate to COVID-19? Well, you all know that this COVID is not going to go anywhere for a long time. It's ebb and flow. We have discovered various variants, and depending on how tight and cohesive our community works, COVID will linger. So the sooner we all get or aware to doing what we need to do, hopefully we can control this incredible virus that's wiped out many, many parts of the world. This disease obviously has caused us a lot of worry. Some of us have been affected by the death or sickness of our loved ones. So fraudsters, con artists, scammers are loving it. They're loving your fear. They're loving your worry. They're loving your panic. And they use keywords on the phone to try and get you duped, to get you trapped in that large fishnet. Words like, what was your Medicare card again, Auntie? The word again. This is discounted. This is actually free. You've been selected. You are one of the few people in Hawaii. So all of these keywords our volunteers are very aware of, and we try to coach you guys to realize these are some red flags. Just 2 days ago, a person lost in 2 wire cases $160,000 here in Hawaii. $160,000. 2 months ago, a woman lost over $1 million. It was a scam that took her for a 2-year joyride. So even though these are not healthcare scams related to COVID, these scammers are alive and well, and they work sometimes solo, but oftentimes in networks, multi-million, sometimes billion-dollar networks across oceans and continents and seas. Today, we're going to look at where these scams lie, and this is just a short list because we only have 45 minutes or so. Medicare Services, let's look at telemedicine, let's look at home health care, let's look at what Navian Hawaii's work is all about, that's with the terminally ill and their families, called Hospice Care, diagnostic testing, as well as prescription drugs. Let's look at telemedicine. All of us have been through telemedicine appointments, right? It's virtual. It's at our laptop, it's our computer desktop, it's on our phone, etc. So due to COVID, we've had to do telemedicine, and we're not going to stop using telemedicine. In fact, it's become quite convenient for us. We don't have to pay the parking. We don't have to pay the expensive fuel. We don't have to get into our car and put our walker and cane in the back seat. It's been very convenient for us, but you need to watch out that we're not billed for services that you did not approve, that you did not even discuss with your physicians. So be really careful of that. We teach you all this. We teach you how to decode your statements. Beware that people who are pretending to be online, the doctor, You know, we've had cases with other SMP chapters where it's a nursing assistant or a bogus healthcare worker who's willing to take the risk to maybe get your identity. So people, this isn't just about your money. It's really about your personal identity. Once they can connect the dots with your social security number, date of birth, your Medicare number, etc., they can create a profile that becomes no longer you to use, but I get to use your identity. And when it's time to have a treatment or service, you're going to find out you're left out in the cold because Medicare will not honor your request because you've exhausted it. Why? Because someone else took your identity. So we need to be mindful not to get caught. We tell people on the phone, it is so aloha to hang up. It is so aloha to say, I'm hanging up, thank you. I'm going to call the police now. You know, and then they call us and we report it. But you have to understand that you are in control. You must feel that you are in control. If you give that control away, then you need to expect all the consequences that come with that, right? And that's what we teach our own children. So we want to teach our kupuna. We want to teach our ohana members. We want to teach our caregivers. And some of the scams relate to caregivers taking advantage of kupuna, their long-term residents. So let's talk about home health care a little bit. People who are helping you at home or will help you at home should be licensed. They should be certified. They should be blessed by the Office of Healthcare Assurance, or OCA, OHCA, which is our partner through the DOH. And know that, you know, especially if your doctor didn't order a service or treatment, you shouldn't be billed for it. Again, we teach you how to prevent, detect, and report your healthcare matters. Take time to verify the company that you think is offering you adequate home health care. If you need to, check back with Navion, but best always remember, take that moment to call your healthcare plan, call SMP, call your trusted physician, make sure that this is all pono, this is all righteous and good. You have every right to ask for certifications, but even if you don't know what you're looking at, is just say, you know, hold off and let me make some calls and I'll get back to you. Typically, these people who are calling you, emailing you, texting you are bogus. Why? Because for one thing, bona fide agencies such as the IRS, Social Security, Medicaid, Medicare, Navion Hawaii, they will typically do snail mail, right? You notice how your medical bills from your doctors are usually not online, right? They do snail mail, the standard, put the stamp on the envelope, lick the envelope and mail it to you. Let's look at hospice care because this is the work that we're in right now with Navion Hawaii. It is a much needed service. Some of us will be deemed terminally ill within perhaps 6 months to a year, maybe longer. We've had loved ones, my own family, through hospice. And these are very trained, highly skilled professionals, right? They know compassion to a fault. They're more than sympathetic, they're empathetic, right? And they love what they do. It is a calling to be working in hospice. It's not just a job. Well, imagine the Department of Justice from 2009 to 2018, almost 10 years, discovered that an agency involving several doctors in Texas deemed patients with serious long-term care diseases such as Alzheimer's qualified for hospice, told them that they had 6 months or less to live. These doctors were so persuasive to these patients who were losing cognitive power that they were able to enjoy a lavish lifestyle with all of the money that they were raking in. And you can actually read about this on Google. You can look up keywords such as biggest hospice scam, and you can put in Texas, and it'll show you the multi-billion-dollar scam that the DOJ uncovered, and it took several years. But these physicians and other healthcare workers are now in jail. They're having to pay restitution for the victims and so forth and so on. But a lot of physicians are willing to risk their licensure from medical school and all their tuition, they're willing to risk it all for the love of money so that they can maintain their lavish lifestyle on your account. So be very careful. The latest one was about $152 million. Hospice, again, just to recap, certified licensed professionals who keep up with what's called continuing medical education, CME. They actually go to school, they have classes, and they need to maintain and increase their CME credits to stay right with the state of Hawaii and other states. Be careful that bills are not bogus, but they're real. And just know that if you give away your accounts, your money, your identity, you're helping to maintain the rich lifestyle of these people who don't give a rip about us. So be really careful. You have control until you let go of it. Diagnostic testing is another scam area. Blood tests to diagnose your issues, whether you have COVID or to what degree your illness is. We had scams going on in the Bachelor Street area, Lanakila area, where genetic testing was used to scam people's identities. Allergy tests is another area, and anything respiratory or cardio related, that's another big one, especially on the mainland. People are seeing pop-up tents and they look all legit, but they're not. And so even our lawyers with S&P who consult with us have reported to be careful of these pop-up tents. Here in Hawaii, from Haena Beach Park to Hilo, we're very noticeable, right? But in big states like Montana, Wyoming, and so forth, gullible, vulnerable people are going to think that they're getting a free test, when all they really want from you is your Medicare number, and then some. So we're going to recap a little bit. Medical services involving prescription drugs, that's another area that we wanted to spend a little bit of time for. In the prescription area, let me go back. We have found that pharmacists, pharmacy technicians, physicians, nurses, many of them are willing to take the risk of being able to bring prescriptions into their homes, sell it on the street, sell it in the shopping malls, sell it at the cinema theaters. Also, because a lot of it may look like just water in a flask, right? Or even a see-through flask. They're willing to take a risk at their certifications. And it's unfortunate because these healthcare workers are really hurting the system. So just remember, just because you're working with a physician or a certified professional, you need to be also suspect, right? So have trusted relationships with the ones you work with. Know your CNAs, your certified nursing assistant. Know the people that you're paying co-payments to. Know who knows your Medicare information, and never give it out on the phone, email, text, etc. Your doctor's offices already have that information. There's no need for you to give it out. All right, so we'll circle back to some of this again, and let's segue now to how these scammers are able to find us. And we'll reintroduce Jazz at this time. Jazz? You're gonna need to unmute yourself.
Yes, thank you, Norma. How is everybody doing? I hope everyone's doing well today. So how do scammers find you? The main ways are through the internet, social media, your text or telephone number. They may send things through mail. They may post things on bulletin boards, as well as find you in person at a fair or an exhibit. So let's take a closer look at the fraud schemes linked to all of these methods that I've mentioned. So social media, this is a big one because right now, a lot of us are homebound and we're not able to go out and see all of our friends and family. So we rely on our social media. So some concerns that happen with this is the posting on your social media accounts of your health status, your symptoms, even just general frustrations about how the state is addressing this pandemic. And I know all of you have had something like this that you've probably posted on your social media. So this, though, can be an invitation to these scammers and con artists who would want to contact you. So just be very cautious of what you post on your social media regarding your health status. For example, maybe you might post that you just took a COVID test, and then say a few hours later, you're getting a contact from a nurse saying that you tested positive. And then as a result, they need your Medicare number. They might need your credit card just to help you get your treatment situated and underway. Chances are these are probably a scam or a fraud from scammers who may have read your social media posts and thought, okay, this is an easy person. They're gonna respond just because they're freaked out because they got tested positive. So as Norma has mentioned previously, you want to make sure you know who's your physician, know your doctors, work with them. You've worked with them in the past. They're trusted people. Work with your healthcare providers, and always suspect unsolicited calls. I'm telling you, you have to suspect the unsolicited calls. And social media is a big thing for me. I actually do not have a social media account anymore. I did in the past, but I just cannot express how important it is. So often we post things on our social media thinking that only our friends and family cares about what we post on and what we have to say. But there are scammers who go on. They're creeping on our profiles, looking at what we're posting, where we're checking in, what restaurants we like to go. Maybe if we check in enough, they'll know your patterns. We're creatures of habit. We go to one place to the other, to the other, to other. And so these scammers are watching us, and so often we don't know it. And even if you put some of those security features on your account, there's no guarantee that someone didn't hack it. And maybe not necessarily your profile, but there's no guarantee they haven't found a loophole or a way around it so that they can at least look at the content on your social media accounts. So and they're gonna target you, especially if they realize that you're vulnerable and less likely to realize how dangerous it is to put your information, any information, out there on the web. And I just can't, outside of just the healthcare information, I just cannot stress how important it is to be aware and be wary of what you post on your social media sites. Okay, so telemarketing it's a perfect storm for people, particularly our kupuna who live alone and who they're waiting their calls from their loved ones or for their appointments. So they're gonna more likely answer their phone. And as Norma mentioned earlier, they're going to offer things. They're going to say those keywords like discount, free product, services, treatments, and they're skilled at persuading our kupuna to provide their personal information and their Medicare number. And while it might seem harmless initially to accept this treatment, accept this back brace, as Norma has mentioned in the past, if you accept it, they can take your identity, they can go and charge you on it, charge Medicare on it. And then when you actually need that service, when you need that treatment, they're gonna cut your line and say you've already received it, you don't need it. So it's very important to be aware of who you're giving out your Medicare number to. And going back when we're talking about robocalls, I don't know how much, I'm sure all of you have experienced it. This past pandemic, there has been so many robocalls that have been funneling out. Just last month, in 2 hours, I got 15 robocalls and they were sneaky. The first 3 digits of the number besides the 808 was the same as my number. and all the last 4 was all different. 15 calls. They called every 5, 10, 15 minutes for 2 hours straight. And that was, I've never experienced that, but I want you to know and be aware that they're persistent, they're sneaky, they're going to try to do all they can just to catch you.
You know, Jazz, that's a great point. Because we work with the Federal Trade Commission, right? We have our lawyers on the West Coast on Wilshire Boulevard in LA. And, you know, just checking in with them every now and then. I just wanted to point out your point more, that they estimated 2.4 billion robocalls each month during COVID. And like you, we all become the victim of, all they got to do, right, is just plan on one slip, like 1 nanosecond slip up. Like they're just hoping for us, the pinky toe just fall down a little bit. That's all they're hoping for. They don't need the bambucha toe. They just need one of our things to fall apart, and we can never get it back. And that's why I think the few seconds that people engage on the phone, like, what did you say again? And then they keep talking, and the more that they are on the phone with you, the bigger the fishnet for you to get trapped in. So thanks for bringing that up. All right, let's go on to the next one then.
So, while mail and print. So while we may have a lot of scams that occur through online or robocalls, there's still the traditional ones that appear through our mail and through print. So scammers will use letters that look like legit companies that you might be familiar with. They'll use, they can use both personal mailing as well as the mass bulk mail that you get. They'll put it on flyers and posters, and they'll post it on your community boards in where you live, in places where a lot of senior apartments, senior housing, maybe grocery stores. And just like Norma said, all it takes is for just that one slip. We're going to look at it. We're going to be curious. We're going to call it. And then they've caught us. We got tangled up in that net. And also, again, they'll also do things like newspaper ads, all of this just to further their schemes and catch you. So another way you can be a victim is when criminals try to scam you in person. They might target, as I mentioned, senior apartments, assisted living facilities, other locations where our kupuna might frequent, and they're the ones that are a lot more vulnerable to these kinds of fraudsters and schemers. So be on guard to those door-to-door sales people. They offer like those in-home visits, especially when it's done without notice. And they catch you by surprise, because we're naturally not guarded. And when we get caught by surprise, we're likely to respond and fall into a mistake, and without even realizing it. So this could allow other crimes to happen, such as assaults and robberies. So make sure that you call 911 immediately if you believe any of yourself, your friends, your family are in danger of these. And just be aware, a lot of these scammers, these they don't look like these run-of-the-mill thieves in the night. They are going to look the part. They are going to look sharp. They're going to look professional. They're going to sound like they know what they're talking about.
Right.
So don't underestimate the level and the steps they will take, these scammers will take and are willing to take to dupe you from all your livelihood. As Norma mentioned, they are often a part of a larger network, and they operate almost like a business, just like our own businesses, places we work at.
Correct. And, you know, another integrity partner you're bringing me to at least remind me is Bank of Hawaii. We work with Bank of Hawaii as the other banks. But Brian Ishikawa, who's the Senior Vice President of Corporate Security, mentioned in one of our presentation trainings from him, and he said, you know, use our information and send it to everybody that you talk to. He spoke of for lack of a better phrase, gypsies, or people that randomly go into neighbors, but they've been scoping your house, your cul-de-sac. They've been looking at your area. And usually what happens, it's a family, and the mother and daughter or father, son will come to your door. It's happened here on Oahu. And they basically, the child needs to go bathroom. She needs to go to the lua. And while you let her in, as kupuna have, because aloha, aloha, they're not in the bathroom. They're scoping the master bedroom out or the rooms. And they're making quick detection of where things are. They're rummaging through all your drawers and everything very quickly, very smoothly, while the mom or the father, either one, not both, they vala'auing with the, if there's such a word, they're talking story with the kupuna, trying to make nice, and then thanking them for allowing them to use the bathroom. So then they'll come back when kupuna is either at home, they don't care, they love the thrill of you being scared, or when you're away, to go in there and steal. So just letting them in, you think for the bathroom, you can just direct them to the public park or say, no, I'm sorry, thank you though, thanks for asking, and then just shut the door. Don't even open the door. Just speak from where you can, or don't even answer the door. So just want you to know, this is coming from our Bank of Hawaii. And just to put a note here, that Brian also said that when banks are robbed, let's say Bank of Hawaii gets robbed, right? Bank of Hawaii security, his team will call First Hawaiian Bank, especially downtown where they're all close together, right? They will call the next bank. That's how neighborly and tight these banks are, because they don't want the other banks to suffer. So I thought that was incredible when he shared that with us. I did not know that. I would think that they would only take care of their own hale, their own banking institution, but he said, no, if we get hit, likelihood the thieves will hit the next bank. So I just thought that was pretty incredible. So I'll turn it back to you. I don't even have a segue for that, Jazz, but except to say, be careful of the in-person.
Yes. Thank you, Norma. So now let's talk about how SMPs help Medicare beneficiaries protect themselves from others from Medicare scams, such as the ones that we've just described. So our Social Security number and Medicare numbers are valuable to the thieves who want to steal your money and your Medicare identity, your medical identity. So rely on your doctors for the medical advice, for the prescriptions, and do not take the advice of others who offer these Medicare medical services, or those that are unknown people who call, who visit and approach. And never sign a blank medical or insurance form. Okay. Prevention alone cannot help all and cannot stop all fraud. SMPs, we teach our the beneficiaries and their caregivers to detect potential problems by taking the following steps. So keep your records of healthcare visits, services, or equipments received, test results, etc. And what we have, that picture over there, this is our My Healthcare Tracker. We give it out. I'll talk a little bit more about it in a future slide, but this is a tracker where you can keep those records of your visits, your prescription drugs, the services you received, any notes that you got from your physicians about your medical status. 2, file copies of bills received from your doctors, the hospitals, the pharmacists, any suppliers or other healthcare providers. You want to make sure you file them, keep them in a safe place. And 3, save your medical summary notices or your explanation of benefits. These are your medical statements that come in through the mail. And just make sure that you review them for accuracy. So you can take these statements, look at your My Healthcare Tracker where you kept your notes, and line up the items and make sure this is a service I received on this day. This is what I was billed from the provider. And you can line these up so it makes sure you know that you got the right services and you received them on the day they said it was. because sometimes they do have errors that come in and you get double billed. Last but not least, please ask questions of your providers, your Medicare plan, or even call 1-800-Medicare when you don't understand the charges that was billed. So oftentimes you don't understand what the bill is, the charges, and or you don't think you received the service. Another one, you feel the service was unnecessary. So you got a service and you didn't think, why did I get this? Why did they tell me I had to do it? And then another one would be, you were charged for the same thing twice. So make sure that you contact your provider, your plan, question these, always question these when you see them arise, when they come up. Don't be afraid to question it. So here's our recommendation to help you report your concerns. You can call your, as I mentioned before, call your healthcare provider or suppliers first to question the charge. If it was a mistake, ask them to correct it. Simple. If the provider or supplier can't answer the question, then contact the company that you got that issued the bill. Their contact information should be found on your medical statements that you get in the mail. If you're not satisfied with any of those responses, contact SMP Hawaii. After you've collected all that appropriate documentation, all your initial research, contact us and we'll help you understand the difference between what is a suspected fraud, whether if it's an error or if it's abuse. And while we're not investigators, we will look into your case. And then if we find something, if we ourselves suspect that it could be a fraud or abuse, then we'll refer it to the proper authorities and they'll do further in-depth investigation.
Jazz, I just want to make sure we point out the phone numbers audibly in case people
Yes.
are visually challenged. So our toll-free is 1-800-296-9422. Here on Oahu, it's 808-586-7281. If you want to just email us, it's info@smphawaii.org. Some of the people that do email us on our helpline attach PDFs to let us look at what they're concerned about. But please try, like Jazz says, to go the first route, and that's to call your doctor. If you're not happy with the doctor's office, then contact the specific company involved. And if you're still not too cool about that, then make sure you have your documentation ready for one of our trained counselors to work with you over the phone or email.
Yes, and I just wanted to just add on that you can also visit our website, which is smphawaii.org, and they have a portal where you can also report your concerns to us, and that's another way where you can get access to us and get help. So last year, SMP Hawaii, we partnered with the Department of Attorney General and the State Department of Commerce and Consumer Affairs, or as we know it, DCCA. And we produced the 3rd edition of Hawaii's Fraud Prevention and Resource Guide. So this publication provides you with information on how to keep safe from falling victims of numerous frauds and scams, also including healthcare abuse as well. And we are happy to send printed copies through Devi. And if you are interested, so this book, it's a short book, but we are happy to send this to you. And as well as if you go back to slides, that My Healthcare Tracker. These are all free. This is all for you. The tracker, as I mentioned, you can use that to track down all your appointments, your drugs, your doctors, your notes. This will help you with all forms of fraud, not just the medical, but all different forms. And it helps you to on how you can keep safe. Okay, So at this time, we would like to ask you to please complete our poll. The questions will appear on your screen, and there is no right or wrong answer. And I'll read it out loud. Number 1, my knowledge about healthcare fraud, errors, and abuse has improved after participating in this session. Strongly disagree, disagree, agree, strongly agree. And the second question would be, I rate this session as very poor, average, good, excellent. And we'll wait till about 80% for the participants to respond. But in that time, I will continue on with the slide while you guys put your answers in. Okay. So along with Hawaii, nearly 7,000 S&P volunteers nationwide have reached approximately 1.5 million beneficiaries, their families, caregivers as well, all of this last year. S&P conducted more than 28,000 educational events. So events such as this.
Hey Jazz, sorry, sorry for interrupting. The poll is actually done, so it is going to be shared right now.
Thank you.
Awesome. Okay, well, thank you for agreeing the way that we are trying to educate you folks, trying to learn Medicare fraud, abuse, and errors, and how to protect yourself. And then, yeah, 63% said good or excellent, and 38 good. All right. Thank you, Debbie. Well,
thank you, Debbie.
In mind.
Okay. So yeah, 28,000 educational events such as these or exhibits, but in the last year, there hasn't been a lot of in person. A lot of it has been virtual. And we've helped collect an expected $2.4 million in Medicare and Medicaid recoveries and savings. And our team in Hawaii has about 40 volunteers statewide across the islands, and we're always looking for more to join our ohana. So please consider volunteering with us, and we'll be excited to work with you. We can teach you how to use the technology, how to do even some of the different things presenting. You can, if you want to be a counselor, you want to just be a counselor to your family members, consider joining us and being a volunteer. We'll give you all the information so that you can help protect not just yourself, but your families and your loved ones. At this point, I'll be handing the ball back to Norma to conclude this presentation. Norma?
Thank you, Jazz. So on that volunteer note, just know that you're actually championing a worthy cause, right? Keeping people's legacy, keeping their money where they belong. Hawaii prides itself with naming their babies like sometimes 15 syllables long, right? Their names are so precious. So more so as we get older and create a reputation that's longstanding for our generations, more so S&P Hawaii volunteering becomes so important as we ensure that their legacy, your legacy, continues here in Hawaii and abroad. One of the things that new volunteers tell me is like, wow, we did not know we were going to get information directly from Social Security, like big time, like stuff that even the news media don't get yet. We get things from Medicare, Medicaid, advocacy groups, FDA, judiciary. It's just really awesome to be able to have this kind of knowledge, especially Centers for Medicare and Medicaid Services, where we get to meet these guest speakers. They give us their cell number, phone number, email. It's just so cool. So consider volunteering with us. We don't care about the time. If it's 20 minutes, 30 minutes, it's not about the time. It's how you are using your time. And our training is incredible. We've got great trainers. So yeah, join us. And I think you'll feel even more shielded and more, what's the word? More in control of these scammers and those that really want to just take us down.